Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Second generation antihistaminics. These second generation antihistaminics are used only in allergic conditions or in cases of chronic urticaria. We can use these second generation antihistaminics. They have less sedative effect than the others. So among these second generation antihistaminics, second generation antihistaminics, we have fexofenadine. This fexofenadine is also called as Allegra. This fexofenadine is also called as Allegra. Then we have cetirizine and levocetirizine, which can be used for allergic conditions. Loratadine and desloratadine is present, and then we have olapatadine. One more drug is olapatadine, which is used in allergic rhinitis, and we have alcaftidine. Alcaftidine is used in allergic conjunctivitis. Alcaftidine is used in allergic conjunctivitis. Olapatadine is used in allergic rhinitis. We have azilastine, mesalastine, and rupatadine is seen. Among all these, loratadine is actually longest acting and it is less sedative. Loratadine is longest acting and it is less sedative. Whereas azilastine, this azilastine can be used as a topical agent.
thank you and thank you for watching.